Feeling 100% recovered is statistically the highest risk factor for re-injury, because while your muscles recover their strength in days, your tendons lag weeks behind, creating a silent structural failure point. We call this the metabolic gap. Your cardiovascular engine retains capacity far longer than your collagen-based tissues like tendons and ligaments. You have the engine of a Ferrari inside the chassis of a damaged sedan, leading you to push power numbers your structure simply cannot support yet. To plan your return, we must first calculate your physiological decay using the coil and coggin detachment data. Fitness loss is nonlinear. Missing 1 week costs you roughly 3% of your VO2 max, but by 8 weeks, you have lost nearly a fifth of your total aerobic power. Most athletes apply the 10% rule, adding 10% volume per week to their previous training load. This is a critical error. The 10% rule only applies to your new, adjusted baseline. Discard your feelings and use this time-off matrix to determine your day 1 volume. If you were off for a month, you do not start at 90%. You cut volume by half and take 6 weeks just to reach your old baseline volume. But volume is only half the equation. You cannot safely reintroduce intensity until you pass the aerobic decoupling test. If your heart rate drifts more than 10% significantly while holding steady power or pace for 60 minutes, your aerobic base is too fragile for intervals. Once your decoupling is under 5%, follow this strict progression hierarchy. Do not skip to intervals until you have completed a full block of tempo work without pain or inflammatory swelling. Respect the math, ignore your ego, and rebuild your engine properly.